In the previous video, we have focused on the efficacy of ADHD medications in trials that typically evaluate the effects of the medications on the so-called core symptoms of ADHD, which are inattention, hyperactivity, and impulsivity. We may wonder if ADHD medications have positive effects also on other aspects that are important in the life of a child, adolescent, or adult. Well, research studies show that actually ADHD medications do have significant effects also on other important aspects. This figure refers to a meta-analysis pulling together data from the type of randomized controlled trials that we have described in the previous video. That is, the withdrawal randomized controlled trials. In this type of trial, patients are randomized to continue the active treatment or to go to placebo. The meta-analysis found that those who continued the active treatment had a better quality of life, but the effect was lower compared to the one found on the core symptoms of ADHD. However, we should also point out that the concept of quality of life is somehow challenging to measure, and the measures of quality of life have differed across trials. We have also evidence that ADHD medications, in particular stimulants, improve neuropsychological functions, even though the effect is in general smaller compared to the one found on core symptoms. A meta-analysis of placebo-controlled randomized trials estimated the effects of methylphenidate on executive aspects of memory, non-executive aspects of memory, reaction time variability, and response inhibition. Results showed that the effect of methylphenidate was superior to the effect of placebo, but the size of the effect was somehow lower compared to the effect size found for the core symptoms of ADHD. There is also evidence that ADHD medications improve important aspects in the life of a child. For instance, a study has shown that methylphenidate and atomoxetine improved social adjustment in youth with ADHD, including school functioning and peer relationship. There are many other relevant aspects that are not usually measured in randomized controlled trials, either because they are rare or because measuring them would increase the effort and the cost required for the study. We can look at the effects of ADHD on those additional aspects in non-randomized studies, that is, observational studies. However, let's say that I find that individuals treated with ADHD medications do better than those not treated on a number of outcomes. In this case, I can know if this is due to the effects of the medications or to baseline differences between those treated and those not treated. However, there is a particular type of study that allows us to address this problem. This is called the within-subject design. The concept is quite simple. We measure a particular outcome in the same individual over time when they are on and off medications. In this case, we avoid confounding effects due to the difference among individuals. There have been several of these studies performed in very large samples. They have found a number of interesting results. Compared to periods when they were off medications, during periods when they were on medications, individuals with ADHD presented with less traumatic or unintentional injuries, less motor vehicle accidents, at least in male, criminal acts, less substance use disorder, depression and seizure. They also show no significant changes in the rates of psychosis and suicidality. Those individuals with bipolar disorders or mania, when given stimulants without concomitant treatment with mood stabilizers, presented with increased rates of bipolar manic symptoms. However, when given stimulants alongside mood stabilizers, they had a decrease in the rate of bipolar or manic symptoms. So it's clear that ADHD medications have the potential to improve a number of relevant outcomes, in addition to the core symptoms of ADHD. Therefore, when assessing the effects of ADHD medication, it's really important to focus not only on inattention, hyperactivity, and impulsivity. In addition to an informal assessment via psychiatric interview, questionnaires are available to quantify, for instance, functional impairment, such as the VICE Functional Impairment Rating Scale, the self-esteem, for example, the Rosenberg Self-Esteem Scale, or social behavior, for instance, with the Children's Social Behavior Questionnaire, CSBQ. Some clinicians wonder whether neuropsychological tests or other objective assessments could be used to monitor the response to treatment. In general, changes in neuropsychological tests are not well correlated with changes in the severity of the behavioral symptoms of ADHD. So the evidence to support the use of neuropsychological tests or other objective tests to measure response to treatment is still weak, and this is not recommended in current guidelines. However, neuropsychological deficits are important in contributing to the overall functional impairment. Therefore, at least in some individuals, it will be important to track their evolution under treatment.